Hello everyone. Today, we're exploring the medication called Fluticasone Propionate, commonly known by its brand name, Flovent. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Fluticasone Propionate, widely recognized by its brand name Flovent, is an inhalation aerosol that falls under the category of corticosteroids. Its primary function is to prevent inflammation in the lungs, making it easier to breathe. Initially approved by the FDA, it's primarily prescribed for the maintenance and prevention of asthma symptoms in both adults and children. Flovent is not intended for the immediate relief of acute bronchospasm or other asthma attacks. It is also used as a long-term control medication to reduce the frequency and severity of asthma attacks. Flovent works by reducing inflammation and swelling in the airways, helping to prevent asthma symptoms such as wheezing, coughing, and shortness of breath. Warnings: Fluticasone propionate comes with its set of precautions. It's not intended for the immediate relief of asthma attacks or acute bronchospasm. If you experience an asthma attack, you should use a rescue inhaler. Additionally, it should be used with caution in individuals with a history of infection such as tuberculosis or herpes simplex in the eye. Long-term use of corticosteroids can lead to side effects such as decreased bone density, cataracts, and growth suppression in children. It's crucial to follow your doctor's instructions and use the medication as prescribed. Before taking this medicine. Before starting Fluticasone Propionate, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or any of its components. Given its impact on the immune system, those with infections or weakened immune systems should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring and follow-up appointments are advised to ensure the medication's efficacy and to adjust the dosage if needed. You should not take Fluticasone Propionate if you have a severe allergy to milk proteins, as some formulations contain lactose. It's also important to inform your doctor if you have any current infections, especially fungal infections, or if you have recently been exposed to chickenpox or measles. Before starting the medication, inform your doctor if you have ever had liver disease, glaucoma, cataracts, osteoporosis, or any other condition that may require close monitoring. Side effects: all medications can have side effects, and Fluticasone Propionate is no exception. Some individuals might experience throat irritation, hoarseness, or oral thrush, a fungal infection in the mouth. It's important to rinse your mouth with water after using the inhaler to reduce the risk of oral thrush. Other potential side effects include headache, upper respiratory tract infections, and nasal congestion. Additionally, long-term use of corticosteroids can lead to more serious side effects such as decreased bone mineral density, cataracts, glaucoma, and growth suppression in children. If you notice any signs of infection, such as fever, chills, or persistent sore throat, seek medical attention immediately. Other rare but serious side effects include adrenal suppression, which can manifest as fatigue, nausea, vomiting, and low blood pressure. If you experience any unusual symptoms or side effects, it's important to consult your doctor promptly. Interactions: Fluticasone Propionate might interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Specific interactions may occur with medications that affect the immune system, such as immunosuppressants or other corticosteroids. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Fluticasone Propionate. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended dose of Fluticasone Propionate varies based on age, severity of asthma, and previous treatment. For adults and adolescents aged 12 years and older, the typical starting dose ranges from 88 micrograms to 220 micrograms twice daily, which may be adjusted based on response. For children aged 4 to 11 years, the typical starting dose is 44 micrograms to 110 micrograms twice daily. It's important to follow your healthcare provider's instructions and not alter your dosage without consulting them. Avoid: while on Fluticasone Propionate, it's advisable to avoid exposure to infections such as chickenpox or measles, as the medication can weaken your immune system. Given the potential for oral thrush, it's wise to rinse your mouth with water after each use of the inhaler. As with many medications, it's recommended to avoid close contact with people who are sick to reduce the risk of infections. FAQ. Many wonder about the age restrictions for fluticasone propionate. It is approved for use in children aged 4 years and older for the prevention and control of asthma. However, its safety and effectiveness in children younger than 4 years are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of fluticasone propionate. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.